Hi, everyone. Thanks for joining our webinar today. My name is Sydney Powell, and I'm in the marketing department here at Revell. I'll be the organizer of today's webinar, and we're super excited to have you on the line. We have some great information lined up on all things annual wellness visits, but before we get started, just a few reminders. I will be recording this webinar, and I will email you afterwards so that everybody will be able to have a copy of the webinar recording and the slide deck. And then also after the presenters have finished their demos and their slides, we will have some time at the end for live questions. So moving on, I'd like to introduce your presenters this morning. First up, we have Marie Moss, who is a coding auditor here at Revell. And then following her is Meredith Angel, who is a certified eClinicalWorks trainer and implementation specialist. So they are both very qualified, and I'm really excited for you to hear about them. So I'm sure there's a couple people on the webinar today that might wonder who we are and what we do and why we're presenting on this topic. So to explain Revell a little bit, we are one of the few end-to-end revenue cycle solutions built for eClinicalWorks users who want an integrated, data-driven, and dependable service. Unlike other RCM solutions that leave your in-house staff following up on claims and answering patient phone calls, Revell offers the expertise, scalability, and efficiency healthcare leaders need to build a richer revenue cycle in a rapidly shifting healthcare environment. We take a team approach to our success. Revenue cycle management automation is meant to support our solutions, not replace it. We assign our clients a client success team lead by US performance managers, and these team members come with years of experience dealing with RCM challenges, and they're here to help serve the day-to-day needs of our customers. You can also expect to work with a billing consultant, coding consultant, team leads, and eClinicalWorks certified trainer, among other team members supporting the RCM process, which also includes certified coders and patient service representatives. As a revenue cycle management service, our goal is really to be a partner with our clients. We know that staying up to date with everything in the Medicare and medical billing field can be challenging, but we care about your success and we want to share our knowledge and expertise on everything, including our topic for today's webinar, annual wellness visit specifications. If you have any questions about how we help our clients keep up with the industry changes and increase their cash flow, we'd love the opportunity to connect with you after the webinar. We're so thankful that Marie and Meredith could join us today. They've really put together some great content that I think you'll find very helpful if you're looking for ways to stay informed and updated on the details surrounding annual wellness visits. So a quick glance at our agenda today. We're going to be covering annual wellness visit initial and subsequent, advanced care, wellness visit eligibility, and opioid use. So yeah, a great agenda, and we're really excited to have you on the line. But enough from me, what you've actually all been waiting for. I'm going to pass it over to Marie.
Thank you, Sydney, and thank you everyone for joining us today. And with that, let's begin. So those of you who weren't able to join us last week as we went through the IPPE, and as we all know, that's the Welcome to Medicare. So if you didn't get a copy of it, please reach out to us. We'll be glad to provide that for you. But now we're going to move on to the part 2 series of this, and this is with the annual wellness visits. So with the annual wellness visits, here we go. I'm sorry, we didn't click over. So with the annual wellness visits, this consists of the initial and the subsequent visits. It's not a routine physical checkup, for Medicare does not cover routine physical examinations. It is a personalized prevention plan service. Medicare waives both the co-insurance or co-payment and the Medicare Part B deductible. The annual wellness visit does not include any clinical laboratory tests, but you may make referrals for such tests. Generally, you may provide other medically necessary services on the same date of the service of an annual wellness visit. However, beware the deductible and co-insurance or co-payment may apply for those other medically necessary services. And we're going to learn more about that in the Part 3 series. Medicare pays for beneficiaries who are not within the first 12 months of their first Medicare Part B coverage period. And those who have not received an IPPE or an initial preventive physical examination or an annual wellness visit within the past 12 months. Medicare covers an annual wellness visit when performed by a physician, this being a doctor of medicine or osteopath, or a qualified non-physician practitioner, such as physician assistant, nurse practitioner, or certified clinical nurse specialist, or a medical professional. And this can include health educators, registered dietitians, nutrition professional, or other licensed practitioners, or a team of such medical professionals who are working under the direct supervision of a physician. And this is a physician of medicine or osteopath. When you furnish a significant, separately identifiable, medically necessary evaluation and management service, in addition to the annual wellness visit, Medicare may pay for the additional service. Report the E&M code with modifier 25. That portion of the visit must be medically necessary to treat the beneficiary's illness or injury or to improve the function or malformed body member. If you are going to bill the E&M by total time, you can only use the time associated with treating the illness, injury, or improving the function of a malformed body member. Not any of the time can be associated with the annual wellness visit. For the diagnosis, you must report a diagnosis code when submitting a claim. Since you are not required to document a specific diagnosis code, you may choose any diagnosis code consistent with the beneficiary's exam. The Z00 codes are the most commonly ones used. The Z00.00 is for an encounter for a general adult medical examination without any abnormal findings. Z00.01 is an encounter for a general adult medical examination with abnormal findings. So with that, the coding guidelines are to use the additional codes to identify those abnormal findings. And think about it. Therefore, providing those additional diagnostic codes supports appending the modifier 25 to the E&M. And more importantly, always reference your Medicare administrative contractor for any coding and billing guidance. So let's begin with the initial annual wellness visit. Medicare pays only one initial annual wellness visit per the beneficiary's lifetime. The billable codes for the annual wellness visit is G0438. This is for the initial visit, and it has a allowed amount of $169. G0468 is for those who are covered under the federally qualified health centers, the FQHC, and this code is used for both IPPE or the annual wellness visit. And it also includes a typical bundle of Medicare covered services that would be furnished per diem to a patient receiving an IPP or an annual wellness visit. And we'll be going more over this in the Part 3 series. The first portion of the annual wellness visit is to perform a health risk assessment. To get self-reported information from the beneficiary, you or the beneficiary can complete the health risk assessment before or during the annual wellness visit encounter. It should only take about 20 minutes. Something to consider is the best way to communicate with the underserved populations. Think of the persons with a limited English proficiency, persons with health literacy needs, and persons with disability. At a minimum, address the demographic data, including but not limited to the age, gender, race, and ethnicity. Self-assessment of health status, this could be for frailty and physical function. The psychosocial risk, including but not limited to depression, life satisfaction, stress, anger, loneliness, social isolation, pain, and fatigue. For the behavioral risk, including but not limited to tobacco use, physical activity, nutrition, and or health, alcohol consumption, sexual health, motor vehicle safety, such as seatbelt use, and home safety. For the activities of daily living, including but not limited to dressing, feeding, toileting, grooming, physical ambulation, including balance and risk of falls, and bathing. And last, for the instrumental activities of the daily living, once again, it's not including but not limited to shopping, food preparation, using the telephone, housekeeping, laundry, mode of transportation, responsibilities for own medications, and the ability to handle finances. Here we have provided the hyperlink for the HRA. Now for the components of the initial and advanced wellness visit. You're going to find this very similar to the IPPE. So first, establish the beneficiary's medical and family history. At a minimum, document the medical events of the beneficiary's parents, siblings, and children, including conditions that may be hereditary or place the beneficiary at increased risk. Past medical and surgical history, including experiences with illnesses, hospital stays, operations, allergies, injuries, and treatments. Use of or exposure to medications and supplements, and this includes calcium and vitamins. And we encourage providers to pay close attention to the opioid use during this part of the annual wellness visit, which includes opioid use disorders. If a patient is using opioids, assess the benefit for other non-opioid pain therapies. And even if the patient does not have an opioid use disorder, look at any possible risk. Here we have provided a couple of different hyperlinks of information that would be very beneficial and helpful to have this conversation with your patients. The third component is to establish a list of current providers and suppliers. This includes current beneficiary providers and suppliers that regularly provide medical care. The fourth component is to do measurements for height, weight, body mass index, or you may want to have the patient do a measurement of their waist circumference and also blood pressure. Other measurements could be other routine measurements deemed appropriate based on the medical and family history. The fifth component is to detect any cognitive impairment that the beneficiary may have. Assess the beneficiary's cognitive function by direct observation while considering information from the beneficiary reports and concerns raised by the family members, friends, caregivers, and others who accompany the patient. If appropriate, use a brief validated structured cognitive assessment tool. And for more information, you may want to refer to the National Institute on Aging, Alzheimer's and Dementia Resources for Professionals website. That's a lot of great information. The sixth component is to review the beneficiary's potential risk factors for depression, including current or past experiences with depression or other mood disorders. You can use an appropriate screening instrument that you may find from various available standardized screening tests designed for this purpose. For more information, you can also refer to the depression section on the Substance Abuse and Mental Health Services Administration, Health Resources and Service Administration Screening Tools website by just clicking on these hyperlinks. The seventh component is to review the beneficiary's functional ability and level of safety. Use direct observation of the beneficiary or select appropriate questions from various available screening questionnaires or use a standardized questionnaire recognized by the National Professional Medical Organizations to assess, at a minimum, ability to successfully perform the activities of daily living, fall risk, hearing impairment, and home safety. The eighth component is to establish an appropriate written screening schedule for the beneficiary, such as a checklist for the next 5 to 10 years. Base written screening schedule on recommendations from the United States Preventative Services Task Force and the Advisory Committee or Immunization Practices. The beneficiary health risk assessment, health status, and screening history, and an age-appropriate preventative services Medicare covers. And once again, we'll go over those preventative services in our Part 3 series. The ninth component is to establish a list of beneficiary risk factors and conditions for which primary, secondary, or tertiary interventions are recommended or underway. And this can include mental health conditions, including depression, substance use disorders, and cognitive impairment, risk factors or conditions identified through an IPPE, and if that is available, and treatment options and their associated risk benefits. The 10th component is to furnish the beneficiary's personalized health advice and appropriate referrals to health education or preventative counseling services or programs. This includes referrals to educational and counseling services or programs that are aimed at community-based lifestyle interventions to reduce health risk and promote self-management and wellness. And this includes like fall preventions, nutrition, physical activity, tobacco use cessation, weight loss, and cognition. And the last component for the annual initial annual wellness visit is to furnish at the beneficiary's discretion an advanced care planning service. And this includes future care decisions that may need to be made, how the beneficiary can let others know how about their care preference, caregiver identification, and last explanation of advanced directives, which may involve the completion of standard forms. As we learned in the Part 1 series, that patients many times file a living will with their attorneys and believe that this will be accepted by their healthcare provider. There needs to be a discussion between the healthcare provider and the patient to determine if they are both in agreement of the patient's wishes of their end of life. Moving on to the subsequent annual wellness visit, which can be performed every 12 months following the previous annual wellness visit. The provisions of the subsequent annual wellness visits are the result of an updated health risk assessment and components of the annual wellness visit as it pertains to the individual patients and their abilities. The billable code for the subsequent annual wellness visit is the G0439, and for the Medicare allowed amount of $134. You can bill a significant, separately identifiable medically necessary evaluation and management service in addition to the subsequent annual wellness visit, as long as it is medically necessary to treat the beneficiary's illness or injury or to improve the function of a malformed body member. Just remember to append that modifier 25 to the E&M, and for those diagnostic codes to support the reason of an additional code of an E&M. So moving on to the components of the annual subsequent visit. I'm not going to read through all of the data because it's almost identical to the initial. But as it stated just a moment ago, that all you need to do is to review and to update. So beginning first with that health risk assessment, you would review that and update as needed, and just confirming that information with the patient and making a simple statement in the documentation that you reviewed the initial health risk assessment and components and a mention of each change if there are any, and then always date it and sign it. So like I said, update of the beneficiary's medical family history. Go through those questions. Update the list of current providers and suppliers. Also, you'll need to do a remeasurement of the weight and blood pressure and any other routine measurements as deemed appropriate based on medical and family history. Such as if the patient has hypertension, you would definitely, like I said, do that blood pressure. If they're diabetic, do a glucose measurement. For the fifth component of the subsequent annual wellness visit is to detect and any cognitive impairment that the beneficiary may have. So you want to reassess any direct observation or have any conversation with the family members, friends, caregivers, or others. For the sixth component, update the written screening schedule for the beneficiary. For the seventh, update the beneficiary's list of risk factors and conditions for which primary, secondary, tertiary interventions are recommended or underway. For the eighth component, furnish and update as necessary the beneficiary's personal plan, which includes personalized beneficiary health advice, a referral as appropriate to health education or preventive counseling services or programs. And remember, this is for those fall preventions, nutrition, physical activity, tobacco use cessation, weight loss, and cognition. And the last component of the subsequent annual wellness visit is to furnish at the beneficiary's discretion any advanced care planning services. So make sure that you go back over asking the patient, and this is a very sensitive topic with the patient. Anytime you talk about end of life, nobody wants to hear about that. So it's a very sensitive topic, and you definitely want to discuss with the patient. Have they made any decisions, that have been different from the initial annual wellness visit? Along with the annual wellness visits, for the females, you may want to perform a cervical or vaginal cancer screening, pelvic and clinical breast examination. You will code this out with the G0101, and an approximate allowed amount is $40. Just make sure that out of the 11 elements of this, that you at least have completed 7 of them. So many times we see where they bundle a couple of them together, and that is not true. Make sure you go down through this list. The copayment and deductible are waived with the G0101 if billed accordingly to the schedule of a high or a low risk, which we'll go over in the Part 3 series. So as you can see, I'm trying to intrigue you to join us for that series. All right, now for the prolonged preventive services, which may be reported in conjunction with the covered preventative service. So depending upon, some of these visits are going to take some time. And so if it gets beyond the amount of time, you can definitely code along with that the G0513 for the first 30 minutes and the G0514 for each additional 30 minutes. Beyond the first 30 minutes of the G0513. Just make sure that your documentation supports the amount of time that you are. So as soon as you begin the annual wellness visit, I would definitely log the time and make sure that you stay within the time frame. And here are the advanced care planning. Now, as we noted in the initial annual wellness visit, component number 11 was for advanced care planning. And in the subsequent annual wellness visit, that was the 9th component. Here's something a little bit, a lot of people do not know. All right. So even though it is a component of the annual wellness visit, okay, you can't do this with the IPPE, but you can do it with the annual wellness visit, whether it be initial or subsequent. You can bill separately for the advanced care planning. However, you must append modifier 33 to this, okay, in order to bypass the copayment for the patient or deductible or coinsurance. So yes, you can bill in addition to the annual wellness visit because it is considered an optional element of the annual wellness visit. So just make sure that you append that modifier 33. Also, anytime between the annual wellness visits, anytime during that year, that 12-month period, the patient wants to come back in and talk to you more about their advanced care planning. Maybe they finally realize that that living will is going to probably be a little hard to obtain during if their end of life is an emergency, that they need to have an advanced care planning. And this can be what's called considered a POLST or a MOLST, which are physician orders or Medicare or medical orders for the physician to carry out as per the patient's wishes. But also remember, there has to be an agreement there. So there needs to be a discussion between the provider and the patient. Okay, so that can be done throughout the year, and the Medicare will pay for that. And there's no amount of times of how many times that can happen. All right, so here I put together a scenario, as you can just see how it could be very beneficial financially. So first, an annual wellness visit averages around $169. A lot of times they do an EKG or ECG of $15. That G0101 for that pelvic and breast exam is $40. For any prolonged services, for instance, the 30-minute one is $67. And then, as I was talking about with advanced care planning, is $87, totaling at $378. And if you do the multiple of 100 female beneficiaries, it's a nice lump sum in your pocket annually of around $40,000. So with that, for the annual wellness toolkit, we have provided some additional information here. If you want to see what a paper version of that health risk assessment is, also there is an electronic version. And then for the advanced care planning, there's additional information about that. And then there's a couple of patient handouts to help them understand of what's their responsibilities and what they can do to help with this. There's also the patient letter that you could be sending out to your patients, especially those who are in the 64 age range. You want to let them know that, hey, soon you're going to be available for this, and get them on board with getting scheduled for it, and also getting them the checklist. There's a little pocketbook checkbook list that you can have the patients so that they know from time to time of what is needed from them. And one of the things is, please remember, patients do not remember, and a lot of times these are performed as an office visit. Patients do not realize that an annual wellness visit is happening. And so if you were to ask them, they probably are going to give you maybe some incorrect information. So always go to your physician portal of your MAC and to determine the status of their annual wellness visits. And with that, wraps up my portion. And now I'll be happy to hand this over to Meredith.
Thank you, Marie. All right. Okay, double checking you guys can see my screen. Great. So I'm going to take you through the ECW portion of how we can make things easier for you to see your patients with these annual wellness visits, and some ways that the system can help you as well. To get started with And for those of you who were on the presentation last week, a very easy and simple report that we can run that's extremely useful is under registry. And last week, Therese showed this for all of your patients who would be in their 65th year, so eligible for the IPPE. But you can also run it for your patients who will be in their 66th year and therefore eligible for either the initial annual wellness visit or the subsequent annual wellness visits. And the reason for running this report is that you can, send them a letter, send them an email. You could even call these patients or send them a message via the messenger to let them know that, they're due for their annual wellness visit, and you can get them into the office that way. So actually this initial date of birth can be anything. We'll just put it January 1st of 1900. And then the last patients would be turning 66 this year, so they would have been born in 1955. So when I run this, I'm going to say run new, and it will show me all of the patients in my system who are at least 66 years old. Now, another thing that you can do is maybe some of these patients are already scheduled for their annual wellness visit for this year. So you could come here and on encounters, you could say, people who are scheduled in 2021 all the way throughout the year, they've already scheduled their annual wellness visit. You can eliminate those from your search so that you're not calling people, or if you're using Messenger, you're not wasting money by sending them a message for people who already have it set up. So the best way to do this is if you have a visit type set up, so that you would select the annual wellness visit, say okay. And what I'm going to do now is I'm going to run a subset of people not. So what that'll do is show me people who do not have an annual wellness visit scheduled this year. So I'm taking from the group of people who are 66, I'm taking away the people who do not have, I'm taking away the people who do have an annual wellness visit scheduled. So what we're left with is our list of our patients 66 and up who do not have an annual wellness visit scheduled this year, so that you can therefore call them, send them a letter, send them a message. All right, so that's the registry report. Again, very useful. Registry can be used in all sorts of ways. If you haven't explored it, I definitely would recommend looking into it. One person can be in the registry at a time, and it is controlled by a security attribute, so you have to have that attribute in order to access the registry. All right, so getting into today's schedule so that I can show you the template that we have built. I'm going to go into my patient. I'm just want to show you as I click into her appointment. One of the things you can do is set up a global alert so that it says AWV eligible, so that this is a annual wellness visit patient, and just an alert for your staff to know that. As you can see, I've scheduled my test patient Kim for her annual wellness visit today. I don't have an annual wellness visit, initial or subsequent. You could do that. You could set up two visit types that it says initial annual wellness visit, subsequent annual wellness visit, however you would like to do it at your practice. Since I just have a general annual wellness visit, I'll leave it at that. I could enter a reason here, just say again, this is for an annual wellness visit. And then let's get into the progress note. So blank progress note thus far. I have a template built. Some of you, depending on when you first signed with ECW and had your data set implemented, some of you may have annual wellness visits from ECW as part of the template series that they initially uploaded. However, if you have been on ECW for a long time, you likely will not. It is worth asking, I think, ECW if they can upload those annual wellness visit templates if you do not currently have them. they might not be able to do it, but we can always help you build a custom template so that it includes all of the information that is on that template from ECW. It's just you might not have it in your system already. Whereas if you're a newer database, again, you will have these annual wellness visit templates. To view this template, those are just my initials, AWV. Again, I can go to that little eyeball. It will show me everything that's on the template so that I can confirm that this is the template that I want. And before I import it for this patient, I want to show you, because for subsequent visits, as Marie said, you can review their preventive health data. I'm sorry, their health risk assessment. I knew I was going to mistake that, but the health risk assessment data, all of that data that Marie mentioned that you review on the subsequent visits, you can pull in the patient's initial annual wellness visit or their IPPE visit information from the HPI section. So again, what I did here is I clicked this little yellow caret. So instead of filling everything out from scratch, I can look at it and I can say, yep, I want to merge this into my now subsequent annual wellness visit, and it will minimize some of the time your staff has to fill out that information. You can also do that with another big section here is the preventive med section. And you can see the counseling. So this is the living will, and as well the more general information, your BMI, your waistline, other risk factors that you have educated them with preventive wellness. You can merge both of those in. Again, that is if you have seen this patient for either their IPPE or for their initial annual wellness visit, and you're now seeing them for their subsequent, you will have information already under these carets. For right now, I'm going to bring in the template from scratch. And you can see we have this whole long template here. But everything that you'll need is on this template, which makes it much easier to fill out. So to start at the beginning, scrolling back up, some of this information you don't need. I just put it here for our education on this webinar. So again, as Marie mentioned, the FQHC, you use code G0468 for the initial annual wellness visit G0438 and the subsequent G0439. The health risk assessment takes up the bulk of your HPI. There are ways in which you can make documentation a little bit easier for yourself. So, and for some of these questions, you can build the data under the health risk assessment, or since it's already built into the system, like one of the items that you need is the tobacco screening. So you can go to your smart forms and use the tobacco control screening from here. You can also use your sexual history screening, your PHQ-2 and 9 screening, your opioid screening. All of those are built in as smart forms. If you look at my list of smart forms and you say, hey, I don't have that, or I'm missing this, these are all of the free smart forms that ECW has available. If you are missing something and you would like it, simply put a case into ECW and say, I'd like this Audit C smart form, I'd like the opioid screening smart form, and they will be able to upload that into your system pretty seamlessly. We build all of our templates as structured data. And the reason we do this is because you can recall structured data. So from that registry that I ran the report for all of our patients who are 66 and older, you can also recall data that is structured within the template. So what I mean by that is if I ever wanted to look up a list of my patients who answered, how often do you exercise? Never. I can do that under the registry. I can see all of my patients who answered that they never exercise. So maybe you're starting, a new program where your patients have benefits if they start to exercise more. Maybe you take a walk a couple of times a week. So in this scenario, you could run a registry report to look at all your patients who never exercise, send them this information about your new program, the incentives to do so. And by having this built as structured data, you are able to do that. There are a few ways to fill out this template as we build it because it is structured data. So I can click on the answer and then I can do this click through section where I indicate all of the answers to the questions. You can, of course, click into HPI. Another way that I actually really prefer is clicking the green category header, because from here you can see all the questions pretty easily and you have these nice drop downs where you can see your answers and move through here. And some of these even, so the squares indicate that they're multi-select answers. We can also build these as radio questions where they'd only be single select, a circle. So as soon as you would select it, it would actually close and be a little bit easier to navigate through here. Momentarily, I'm going to take you through how to build that data. If you are interested and unfamiliar with building structured data in your own data set, I'm going to take you through a little example in a second. One of the items that Marie mentioned, and I want to go through quickly, is having that relevant family history documented for your patients. And under this family history section, I know that it can be confusing. A lot of people tend to use this note section and just manually free type. I want to point out, though, that you can customize these sections up here so that your more prevalent and common diseases up here closer to the front. You can have as few or as many as you would like. As you can see, I have quite a few, so they're a little bit overlapped, but they pop up as soon as you hover over them. And by having them listed here, you can quickly check them off. The little cursor that pops up blinking is for you to indicate the year in which they were diagnosed, if that's important to you. You don't have to do it again, so that's all right as well. But I wanted to point out, I know that some people don't have these customized, but to do that, all you have to do is click Customize. You can add an ICD code, and you can add a custom name as well. So I know that with the ICD-10 specificity, it gets a little bit confusing as to which one you should pick, but you can always pick one and then make your custom name something more general, just like the unspecified essential hypertension. Our custom name is just simply hypertension. Moving down into our preventive data, again, same thing for this data. You'll click into the preventive med for this section, and then you'll be able to go through and answer the information as needed for the BMI and all of the different categories down here. One of the things, obviously we don't have it on the template because it's custom per patient, but you'll have vitals, of course. You can reorder these vitals. Mine, we would probably switch up to have weight and height at the beginning along with heart rate. BMI is a little bit further down here, I think, too. So you can customize these as well if you have not done so already. You can also, as you can see by the asterisks, you can make those mandatory to fill out, which I need to do now. 1 second. Okay, good. Now moving back quickly here, I'm just going to give a brief example of how to build that custom structured data. I'm going to do it under the HPI. So first, if you wanted to create a new category called annual wellness visit, ours is just called BP, those are initials of a coworker, but you can have it just annual wellness visit, annual wellness visit, initial female. These actually came pre-built into the system, all of these different categories, I believe. But you can build your own section to make it easier. If you need to add a new folder under HPI, what you'll want to do is highlight HPI first, go down to category and say new. And that will give you the folder that appears under HPI. So for example, that would give me this BP Medicare annual wellness visit. Now to add a symptom, to add all of our questions in here, you'll highlight the folder that you want it to be listed under, click on custom, click on add, and Everything's already built on the template. I'll just add how many times have you fallen in the past year. Okay, after you've added your question, you'll want to check off that it's structured. Again, that makes it retrievable in the future if you ever wanted to recall how many patients have fallen, once, twice, all the time. After you've added your questions, you'll want to click into the notes section of that question, go to custom, and then add, and from here you can actually add more questions, like does patient fall often? The type, you have structured text, numeric, date, Boolean, date, just in different formats. So the structured text would be where you put in specific answers. The numeric would be, you get a little like keypad to fill out a numerical value. The date is month, date, year. The other dates are as they show here, but the original date is month, date, year, month, day, year. And then Boolean is just a simple yes or no answer. If you wanted to make the question mandatory so that it has to be filled out, you could do so. And now that value can be answered as either yes or no. I know that was a fairly brief section. So to summarize again, if you need a new category, HPI, category new, that adds your, I call them folders over here on the left, so that adds your folders. To add a symptom, so this would be more of like a title header, like health risk assessment, where you're going to put a few questions underneath. You click custom here and add. You want to check off that it is structured data. After you've put in your symptom, so again, that's like a field where you're going to put more questions underneath. You click into the notes section of that symptom. If you need to add more questions, click on custom, add your question here, answer what kind of text it will be. You can also make a default answer after you've added either structured text, or if it's Boolean, your yes and no will answer here right away. A final step, since I didn't do one as structured text before, if you have structured text and you need to enter answers, you click on the item that is your question with the structured text answer, go to customize structured text, and add all of your possible answers below. Again, you can make one default here. Our default is just the underscore, which we use as a filler, so that prior to filling out the template, you're able to have the question there, and then you can just go in and change the answer to what applies to this particular patient. I know we're getting close to time, and I want to leave a few minutes for questions. The only other item I wanted to mention is, again, you can have your visit codes built in here, especially if you do more customized templates. So if you do an initial annual wellness visit, or if you like visit type or template, so that you can put that specific code there, or if you do one that includes advanced care planning or prolonged services, if you do include all of the codes on your template, if you only have one built, just obviously be sure to remove codes that don't apply to this patient. Some people prefer to do that as well, another option. Thank you all for joining today. Sydney, I will pass it back to you so that we can take any questions.
Great. Thank you so much, Meredith. And just give me a second while I get my screen figured out right here and I will share it. Okay. Yeah, so thank you again, Marie and Meredith. That was a lot of information to take in. So if you missed anything, don't worry. I will be sending you an email later today with the slides and a recording of the webinar. So now that we've reached the end of the webinar, we're going to take some questions that you might have at this time. So if you do have a question, type it into the chat panel on your screen and we will get to those. As we wait for those questions to roll in, I want to make sure you know how to get in touch with us if you'd like to learn more about any of our services here at Revell. Following the webinar, you will get a quick survey. You can let us know how we did or request for one of us to get in touch with you. You can also simply reply to my email later today, and our team will be quick to get back in touch with you to see how we can help. We can also help schedule a discovery call with you and your practice and one of our representatives, and this will help us talk through pricing and next steps for your clinic. If you are interested but aren't quite sure if it's a good fit, I'd still encourage you to get in contact with us so we can put together some detailed information based on eligibility and specific goals. So additionally, this was the second of 3 webinars in this annual wellness visit series. So make sure you come back next Thursday as we wrap up this series. In my email following this webinar, I will include the copy of last week's webinar recording, presentation, and slides so that you can have that at your expense if you need that. So it looks like we do have a few questions rolling in here. So first, if the initial annual wellness visit is denied due to lifetime benefit maximum has been reached, can we change it to an office visit?
Cindy, I'd like to try to answer that because I get this question so often. And with that, something you have to remember is that an annual wellness visit is not for treating any illnesses or injuries or to improve the function of a malformed body member. So if that is solely, that's all been done during that visit, that it was just for an annual wellness visit, the documentation is not going to support an E&M office visit. So nor should you add the time of the annual wellness visit to create an office visit, okay? So the answer is no. You should never just change it because truly the documentation should not support it.
Great. Okay. Can an annual wellness visit be performed as a telehealth service?
Okay, I can answer that one as well. All right, so if it's an audio video, as we all could probably see that, you would think that you should be able to do that. First, I thought I had seen back as we entered into the pandemic that you could do so. But when you go to, the best thing to do whenever a question like this comes up, I always refer back to my appendices with the CPT. And in Appendix P, a P as in Paul, it shows you that no, telehealth annual wellness visits are not part of the telehealth services. So unfortunately, the answer is no.
Okay. Is the exam a full body systems exam?
Okay, well, me again. And it seems like I'm on a roll with the word no here. So I'm sorry for that, but no, it's not. As you can see in today's presentation, it was just a set of measurements for the height, the weight, even using the waist circumference, blood pressure. So only examination should derive from the patient's medical or social history, or any clinical, current clinical standards could also generate a body system examination. But it doesn't have to be a full one. It can be just limited to that condition, such as diabetes. If a patient has a history of diabetes, the doctor probably wants to examine or review their hands, their feet, their skin, and that's it.
Great. Do we have to use a template for annual wellness visits?
Marie and I can probably tag team that. And I think we'd both say again, no, you don't have to, but it does make things a lot simpler, especially when you have that structured data built and you answer it the first time, you can bring it in for those subsequent visits and just update as per needed for the patient.
Yeah, definitely not. You don't have to reinvent that wheel. Make it easier on yourself and just go in and review and update. And you'll be done in a lot short amount of time by doing so.
Great. Are we able to get the annual wellness visit template in our data set?
Our first, yes, you definitely are able to get that. Now, whether it's an automatic upload from ECW or if you already have it, there is a different question. Your newer databases with ECW will have it already built in. The older ones will not, though. Again, you can put in a case ECW and request it. I don't know if they'll be able to do so, but we are definitely a resource that can help you to build that template. We've certainly done it many, many times for clients, building templates into their system. So if you need help with it, definitely reach out to us.
Awesome, great. It looks like that's all the questions that I'm seeing right now, but if you still have a question and just haven't had a chance to type it into the chat, just respond to one of my emails and I will be more than happy to send that over to our team and get those answers or get those questions answered for you. So if you do have a quick minute after this webinar ends, be sure to fill out that survey. And then we are looking forward to seeing you back here again next Thursday, same time, same place, to wrap up this annual wellness visit series. So again, thank you so much, Marie and Meredith. It was a pleasure hearing from you guys, and I am looking forward to next week. All right, have a great day, everyone.